Hi, my beauty. So this is in response to somebody asking me what questions you should ask your provider before having Thermage. And I feel like the number one question should be is, where did they get their device? This is a really, really big deal because a lot of medi spas are trying to cut corners and cut costs, and they'll buy an old used device from like 2007 that's like $10,000, and they decrease their overhead that way. If a provider wants to provide the best for their patients, they usually get the Thermage device, which is from a company that manufactures it called Solta, and they get the device directly from the company. Now that's like a $150,000 device, but you get what you pay for. You get the FLX platform, you get the most updated software, you have the most updated device version, and it minimizes complications. So it's a mixture of having an old refurbished device, and then also like if there's a mid-level or somebody who's not highly trained using these machines on patients, complications can happen. Melting of the fat, less than desirable outcomes, no response. And those things happen when someone's not appropriately trained. There's a lot that goes into the treatment: heat stacking, vectors, super passes. There's different things that go into it. And at our office, we have our own protocol, the tips we use, the pattern that we follow, the surface area that we treat. And a lot of providers ask me for my settings and my protocol, but this is just what I've learned over 20 years of experience, and also having like laser fellowship training. So it's not as simple as just following a pattern and, doing this cookie cutter treatment on everyone getting the same result. You need the updated platform, highly trained people doing this procedure. And then also, don't let anybody put numbing cream on you if you're going to be doing a Thermage treatment. You want the biofeedback from the patient to say, hey, this is too hot, this is uncomfortable, turn it down. Thermage should not be painful. It should be warm. There could be some little zingers here and there, but it shouldn't be uncomfortable. And if it's uncomfortable, then you're at risk for fat atrophy or melting of the fat, because you want to be in a certain temperature range to stimulate collagen. But above that temperature range, not only is it painful, but it can melt your fat. So you always want to be in a certain temperature range, and usually the most updated software of the Thermage device won't even let you achieve temperatures that high. So it's really important to go to someone who knows what they're doing and who's not trying to cut costs, and who has provided the most updated, best software and devices for their patients, like myself and many other board certified dermatologists, especially those of us fellowship trained in laser and devices. I hope this helps and empower you guys. I don't want bad things happening to you, and I want you to get your money's worth from these procedures. All right, love you guys.